Okay, it's July 1st, 2020, and this pumpkin over here just had the Deuk laser disc repair done yesterday, didn't you?
Yes, I did.
All right.
Yes, I did.
And so this is just less than 24 hours after surgery.
Yes, sir.
Now, when most people have back surgery, they take powerful painkillers after surgery because it hurts so bad just to have the surgery. What kind of powerful painkillers are you on today?
I took one regular prescription that you required, which is a Tylenol. I took that this morning, and I've been out walking and done all my exercise. I walked 20 minutes, had no issues.
So you don't need a powerful painkiller?
No, I do. I took the other pain pill you give me. That was last night, muscle relaxer.
Yeah.
I took that one time, but I do not feel I would need that tonight. But I take it at night to help me relax. Other than that.
So after your Deuk laser disc repair, which we did yesterday,
Yes.
you were discharged home the same day, no hospital stay.
Correct.
Did you take any morphine for your pain afterwards? Any powerful oxycodones, anything like that? No.
No.
That's because the incision was this small, 7 millimeters.
Okay.
Now, before surgery, you had bad back pain, lower back pain, right?
Yes, it affected the way I walked. I could walk from the lobby to here, and I would have to sit down. And this morning, I do not feel I need to sit down. I can get up and walk.
Well,
No problem.
can you stand up and show me where that pain was? Go ahead and turn around for it.
Yes. Yeah.
No, you don't have to show,
Okay.
well, you can if you want, you might as well. So
Yeah,
there's
so
where
I
we
see
did
the
your
surgery.
surgery over
Yeah,
there, and
yeah.
there's a tape. You used to have pain in here,
Yes,
right?
yeah, I did in there and it went across and then it kind of went down into there,
Uh-huh.
where it caused me to where I could not stand for
Yes.
very long to do dishes or anything.
Do you have pain in here?
No, I do not.
It's gone.
It's gone.
So the pain from before your surgery is gone.
Gone.
It's cured.
It's cured.
And it went down your left leg. Go ahead and put this down. You can
Yes,
sit
yes,
down.
sir. It went down my left leg.
Do you have that sciatic pain anymore?
No, sir, I do not.
It's gone.
Gone.
All right. So what would you tell people out there that live every day suffering with back pain or leg pain, and they think, oh, there's no way to fix it?
Go see Deuk Spine Institute.
Okay. How much did we pay you to say that?
You paid me nothing.
Yeah, we paid you nothing. That's right. That's right. And you're happy with your results?
Yes, sir, I sure am.
Anything else you want to tell the world on post-op day one?
I'm happy with what took place yesterday because I'm retired and I want to travel and I want to get out and see the country, and you have made that possible.
All right. Now, did you pay for your surgery, or did some insurance pay for you?
No, I paid for the surgery myself. I was blessed enough to have the money.
So you paid cash for your surgery,
Yes.
thousands of dollars.
Yes.
You're sitting here one day after surgery.
Yes.
I'm not paying you to do this interview.
No.
And you're happy as a clam, it looks like.
I'm happy. I'm ready to go.
Okay. God bless you, sir.
Thank you very much.
Good for you. Good
Thank
for
all
you.
of you.
All right.